This is the community meeting offered by S.A. Nichols Brokerage, a marketing plan to help you reach seniors in your targeted selling area. It's a good idea to start your community meeting going over Medicare Part D benefits with this informative video from UnitedHealthcare AARP. Take a look.
People who've had health insurance all their working lives, maybe like you, are often surprised to find that original Medicare Parts A and B doesn't cover prescription drugs. Now, that's where Medicare Part D comes in. It's offered only by private insurance companies. And it helps pay for prescription drugs. You can get Part D either as a standalone plan or included in a Medicare Advantage plan. It's up to you, depending on your needs and what's available in your area. Here's how Part D works. First, it's optional, but if you want it, you have to enroll. Second, depending on your situation, you can sign up for Part D when you first become eligible for Medicare. For most, that's when you turn 65. If you decide to wait, you could be without prescription drug coverage when you need it, and you may wind up paying a higher premium. Third, Part D plans vary by company. So when you compare plans, you should make sure the drugs you take today are covered. Then review the drug copays, any required deductibles, and monthly premiums. For most people, Part D is a smart choice, whether on its own or as part of a Medicare Advantage plan. It can help you save on the cost of your drugs, help you manage your healthcare budget, and provide coverage in case your health needs change in the future. Those are the high points of Medicare Part D. Still want to know more about Medicare? Go to Medicare.gov or check the other videos in this series at MedicareMadeClear.com.
Now let's go over the do and don't highlights and points to drive home for the UnitedHealthcare AARP electronic presentation on Medicare Part D drug programs. Even though the video went over what Medicare Part D is, go over one more time about Medicare Part D and how it works and what benefits your audience is eligible for. On this slide, explain to your audience that AARP Medicare RX offers two plans, Preferred and Enhanced. There is no annual deductible in the Preferred plan. Have a formulary list of prescription drugs there so that people can view it and take a look at their prescriptions to see how they'll be covered. Also, go over how the coverage gap is handled on the Preferred plan. Also, drive home the $2 pharmacy saver benefit, as your audience will like this as a great selling feature. The Enhanced plan also shares a zero annual deductible and includes 95% of the prescriptions covered under Medicare Part D. All the additional great benefits and features of the Preferred plan are also included for just a few dollars more in premium. Since your community meeting is registered as a sales event, you're going to want to spend some time here going over this screen on cost comparison. Go over the difference in the premiums between the two plans, the copay costs at the different tier levels. Here's also a great place to bring up the fact that if people would use the $2 pharmacy saver program and not run their prescriptions that qualify for this program through their drug card, it can keep them from getting into the coverage gap sooner. This screen will have more questions than any other, and you need to spend time on this one. It talks about the coverage gap. Explain to people how they fall into the coverage gap, ways they can keep themselves from going into it too soon, and then also talk about catastrophic coverage stage on the other side of the coverage gap. This screen is a great overview to what you just went over. Tell how both prescription drug plans with AARP have zero annual deductibles, predictable copays. Please remember to tell people this is a network pharmacy program, and even though many of the chains are in it, there's 65,000 pharmacies, but it is network driven. Talk about how great our customer service is, and again drive home that $2 pharmacy saver program. The AARP Medicare RX drug plan has great online tools for your customers to use. They can make payments, view drug savings options, and print health records. They can view claims. They can look at generic alternative drugs, lower tier drugs that are available to them, and the mail order option. A crucial part of this presentation is the discussion of enrollment periods. The initial enrollment period is just like Medicare supplements. 3 months prior to turning 65, the month of turning 65, and then 3 months after. The second is the annual enrollment period, which runs from October 15th to December 7th with a January 1st effective date. And then finally, the special election periods, which would be for someone who may be falling into retirement, someone that is moved out of a particular area of a healthcare plan and has lost their drug coverage, or someone that is on Medicaid. Your community meetings that you hold for the Medicare RX program will be the most heavily attended and have some of the best questions. You do need to tell people that if they miss their initial enrollment period, they're not going to be able to enroll into a Medicare RX program until annual enrollment. That's unless they qualify for a special election period. This is where you can really shine and tell them that you're there to help. These next 2 slides will help you drive this point home to your audience. On this screen, you can tell them that you're here to help them find a plan, discuss their drug coverages, and when they're ready, help them enroll and be confident in their decision. Remember, in these community meetings, you are driving to the scope of appointment. Do not try to sell everybody that is sitting there in the room with you at the meeting. Make sure you're just driving for the scope of appointment and make those appointments later. There is more marketing video training available on this page. The Community Meeting Seminar Prospecting Program, other presentation do's and don'ts for Medicare Advantage plans, Part D, and special need products. Also, there's information on here about how to properly use the Agent Toolkit so that you can create the AARP advertising and marketing pieces you're going to need to promote your community meetings. Also, check out the video on the powerful prospecting tool of the Social Services Checkup. This is a great way to meet more and more prospects and bring them valuable information that they need. Have questions or need advice or just want to discuss the community meeting program? Call us at S.A. Nichols Brokerage, 800-283-0040. You want to schedule an event? Call the United Healthcare Producer Help Desk at 888-381-8581. This is Scott Nichols, President of S.A. Nichols Brokerage, thanking you for your time today. Now plan your work and work your plan. Good luck and good selling.